And we're ready for 9 o'clock, kicking it off Tuesday, third day of the World of Wellness, James Weiner Memorial Wellness Week. So today, folks, we bring you the sensation, the rookie sensation. And, pretty soon, you're going to celebrate your 1 year anniversary, aren't you? What is it, May?
May.
So by the next,
4th,
by the next Wellness Week in May, we'll be celebrating another anniversary,
Yeah.
1 year
Yeah.
with Dr. Phil Ross. So, folks, sit back, get ready. He's been working on this for 2 months because last time he didn't do a PowerPoint, but he's ready for you. Doc, take it away.
Right, thank you. Appreciate it. How's it going, guys? Good morning. So today, the topic we're going to dive into is why you don't necessarily have to be in pain seeing a chiropractor, and if you are in pain, why it would benefit you seeing a chiropractor. So we're just going to kind of go through a couple things to start. So one of the coolest things is her name's Dr. Heidi Hauck. She's a huge pioneer with chiropractic and the research behind it. Unfortunately, it's not widely studied, but she came up with a couple. She studied it, and she is basically seeing the correlation between how chiropractic works and how it actually affects your brain. So a lot of people think you just go to a chiropractor if your back hurts, your neck hurts, you're just going to get adjusted to feel better. However, it actually has some very, very big pros for what it does for brain function and brain health. So one of her quotes, the research shows that you decrease the activity of the prefrontal cortex by almost 20% on average from a cervical adjustment. That's absolutely huge, and we'll kind of dive into why. So your prefrontal cortex is basically kind of the master of the brain. So it's basically going to be involved for all these 9 functions: empathy, insight, response, flexibility, emotion regulation, and a couple others. So when you actually get adjusted, it will stimulate the prefrontal cortex, which is absolutely massive. How this actually works too with the joint position. So a lot of people, if they're diabetic and they have diabetic neuropathy and they don't feel comfortable walking, or they're kind of unsteady on their feet, if you actually get a chiropractic adjustment to your cervical spine, it's actually going to help your brain sync up your feet. So it's going to kind of help with the connection. So it will kind of downregulate the prefrontal cortex there for you. So that's absolutely massive. Just because, again, when you just think of a chiropractor, you're just, oh, my neck hurts and I'm going to go. But it actually is very, very huge for the neurology. So as soon as you were conceived, the first 2 things that form in utero is your brain and your spinal cord. So that just speaks to the importance of it as well. So it will help with improved muscle strength. It can help with better pelvic floor control. And it basically just kind of helps your whole brain as a whole. So that's for the prefrontal cortex. And the other pros to chiropractic treatments is it could actually decrease inflammation. So inflammation, massive pain generator, right? So you mainly have 8 inflammatory proteins. We could just call them chemical soup. And when certain segments get fixated, and that's when you kind of have like disease and pathology happen. So just a quick snippet from an article. So this talks about the inflammatory response following chiropractic treatment. And just to make this a long story short, they did a study with 21 people and they received 9 chiropractic treatments. And it talked about what the inflammation did at the joint level. So the main inflammatory markers in this one was the interleukin-6 and C-reactive protein. Those are inflammatory chemicals. And usually when you have inflammation, that will cause pain. So the inflammation it works with the C fiber on the nerve. So basically what it does is it creates the pain signal. So when you actually get adjusted, if you have a hot low back or a hot cervical spine and any kind of radiculopathy, so neck pain running down your arm, when you actually get adjusted, it should decrease the inflammation at that level. So if you decrease the inflammation at that level, you're going to have less pain, definitely less pain. So that was a pretty cool study as well. And also it helps with microcirculation. So when we get rid of the inflammation, we actually bring the good blood to the area so you could heal quicker. So that's one of the main things. So when the good blood comes, you actually get your natural stem cells that your body, they kind of go to that area just so you could heal a little bit more efficiently. So that's massive because usually when you think you get adjusted, it has nothing to do with inflammation at the cellular level, but actually has a lot to do with it. The other thing too, when you get a chiropractic adjustment, it will also affect the adjacent soft tissue structure. So, for example, if you're coming in and you get your neck adjusted, not only will it kind of affect your prefrontal cortex that we were talking about, it will decrease inflammation, but it will also kind of reset the GTO and the muscle spindle in your muscle. So, your GTO is your Golgi tendon organ. It's kind of like a fast twitch muscle receptor. So when you actually adjust the cervical spine, it will kind of down regulate the GTO and the muscle spindle. So it will kind of just turn off the muscle, so to speak. So it will just allow the muscle to relax and not be in sustained tightness. A lot of people coming in, they always say, Doc, I hold my tension in my upper traps. Very true with a lot of people. So when you actually get adjusted, it should help to kind of down regulate and just kind of calm those muscles down. So that was another cool study. And then the other reason why you don't have to be in pain to see a chiropractor, we do lab work. We help with nutrition. So we could order lab work if you're kind of just feeling a little bit fatigued, if you're having headaches, if you just don't feel right. We could send you for a comprehensive metabolic panel. We could send you for any kind of lab work to check vitamins, minerals to see if you're deficient, and that could be a reason why you're not feeling right. You're feeling a little bit fatigued. You don't feel like you have the energy. You're getting headaches. You're restless when you're sleeping. All that kind of stuff. So me and Dr. Orbach here have been starting to do a little bit more lab work with patients, just because we are very, very fortunate and blessed to have the supplement store right here. So it's very easy. If we send you for B12, vitamin D3, your magnesium, if you're deficient, we just take a walk right out in the store, get you the right product, just to get you feeling as optimal as you can based on your levels. So that's absolutely massive too. And for autoimmune conditions as well. So say we order you some lab work, we get you the right minerals, vitamins, get you on the right protocol for a diet, and you're still kind of feeling off, we could send you for certain things to see if you have high CRP, C-reactive protein. We could send you for other inflammatory markers to see to kind of further if we need to send you to another person, another specialist, or anything like that. And the cool thing about the lab work and nutrition is just a couple here we'll touch on. So the diabetic neuropathy symptoms. So especially with the laser, we're seeing a lot of people with diabetic neuropathy. So the numbness, tingling, pins and needles in their feet, and they don't feel totally set in stone with how they walk. They kind of feel like there's a disconnect from their brain to their feet. So what we could do for that is, we could send you out if you already don't have a PCP. We could send you to see what your A1C is, and then we could kind of manage. And what's fun for me is, we're going to get you feeling better in the room when we adjust you, do the soft tissue, and with the laser therapy, we'll dive into what the laser does for diabetic neuropathy. But if we basically treat you with the laser on your feet, do some certain soft tissue things, and then we could also talk about what we could do protocol wise, with the supplements. So don't want to give away all the secrets, but a good protocol for diabetic neuropathy, we have a great product called Glucolyze, and that will really help to decrease the blood sugar. And then we also get you on the pro oranges and magnesium, and people do great. And usually if we get you on the product and then you go to your PCP within 4 months and go get your A1C measured, sometimes it drops a couple points, and they feel better. They feel like there's more of a connection between their brain and their feet when they're walking, and they have a better gait cycle. So how you walk, you just feel more comfortable in your own skin. And then going back to the inflammatory disorders. So if we sent you for blood work and you have a high CRP, high C-reactive protein, we have a ton of supplements that help with inflammation. Turmeric's a great one. We have X-Flame is, my favorite, just comprehensive, anti-inflammatory, all natural. If you're on any kind of statin or if you're on any kind of blood pressure medication, we could even put you on the Inflame or the Inflam. That really, really helps as well. Those are probably the two best natural anti-inflammatories. You could also take stuff like turmeric, bromelain, quercetin has some anti-inflammatory effects as well as boosting your immune system. So that's really, really fun to work with. And again, we'll touch base on how the laser decreases your inflammation as well. We could also help with different musculoskeletal pathology as well. So if you come in for a grade 1 strain or a grade 2 strain of a muscle, we could get you kind of on like our joint and muscle support. So our HA+, which carries hyaluronic acid, glucosamine, and MSM, massive for joint support. We could get you on the green lip muscle, massive for ligament and tissue, so like the muscle itself, and just a couple other things. So again, me and Dr. Orbach have been doing a little bit more lab work just to make you feel as optimal as you can. And so if you are in pain, what can you do? Laser therapy. We talked about it the last wellness week, but it really, really, really does a lot for your body. So just on this slide, it just talks about, what you could get: pain relief, the vascular activity, so the increased blood flow, huge and anti-inflammatory, faster wound healing, nerve regeneration, rapid cell growth. And we'll kind of dive into a short story about the faster wound healing on the next slide here. So how laser therapy works. So laser therapy is called photobiomodulation. That's the fancy word for it if you want to Google it on Google Scholar or check out PubMed. So long story short, photon energy is what the laser donates. So it hits the tissue and it's absorbed by the cell's mitochondria, more importantly, the chromophores. And that's basically where the healing process starts. In order for it to interact with the cell, the photon energy has to hit the chromophores or it's not going to work. So that's why when you come in and get the laser therapy, we try and stay no more than 2 centimeters away from your skin, just so we could target that chromophore in the mitochondria. And the primary target is that cytochrome C receptor, and that's when we're going to get all the good healing effects from it. So some of the physiological effects from the laser, increase in ATP. ATP is your cellular energy. Absolutely massive. Increases nitric oxide, also helps with O2 perfusion across the cell membrane. Again, we're just trying to get good blood flow to the area so you could heal. The other thing that's a pretty big thing, it opens the calcium ion channels on the nerve. So if you ever hear about someone says, I have that dreaded sciatic symptom, right? So you could call that like a leaky nerve. What the calcium ion channel does is when we get the photon energy on the nerve, think of a straw with a bunch of holes in it. When we hit the laser when we hit the laser on the nerve, it helps to kind of patch up the holes in the straw, so you have a better signal from the nerve root all the way down your leg. And this
Hey,
works
Phil,
great with the.
we have a question from the audience.
Let's hear it.
Do you think it's possible that even though I feel okay, even pretty good, that I can have quick inflammation and need these things that you talk about?
Yeah, 100%. So a lot of people, so for example, I treat one professional boxer, and we treat a couple high-end athletes, and they get lab work every 6 months. So we're going to do their lab work even if they're feeling optimal and they feel all right. You could still send them for lab work and they could be borderline on a couple vitamins and minerals. And when you get them on some supplements, it just increases your overall wellness. And even if you feel good, if you fine tune a couple things, you're just going to reach your maximum potential. So we're trying to get you from, even if you are feeling good and if you do have some short-term inflammation, come in. We could get you on the X-Flame. We could get you on a couple supplements that could decrease your inflammation, whether systemic or local. And then when we order lab work, we could just see if there's a couple things borderline, and then get you the right supplementation just to make everything as optimal so you feel as best as you can. Yeah. So going back to what it does with the calcium ion channel. So you have 3 channels on a nerve. You have your potassium, calcium, and sodium ion channel. Sodium is turned off by lidocaine. Potassium is turned off by mechanical irritation. So what me and Dr. Orbach do great over here is not only do we do the chiropractic adjustments, but we do muscle work as well. So when we do the muscle work and adjustments, that's going to turn off the potassium channel on the nerve, sodium's from lidocaine, and then the last one's that calcium ion channel, which is hard for a lot of people to turn off. So that's why it's really, really nice to kind of get the laser therapy, because then you can hit all 3 channels on the nerve and it stops firing. You stop feeling that depolarization. And so the neck pain running down your arm or the low back pain running down your leg, it totally turns it off. So that's awesome. The other one, it helps with an increased release in growth factor, and it alters the pain threshold. And the biggest thing I think what the laser does is it decreases inflammation. Usually when you have inflammation, I would say not usually, I'd say probably 100% of the time, you are going to have pain. So not only with the supplementation we provide for the natural anti-inflammatories, if we get the laser on certain tissues, if we get it on certain joints, it's going to decrease your inflammation to restore mobility. And it will basically just allow you to have a decrease in pain because we're getting rid of the main 8 inflammatory proteins. So that is, in a nutshell, that's probably my favorite thing what the laser does, just because it's hard to treat people if they have such bad pain, they have such high inflammation. Once we kind of laser the structure, it's going to decrease all the inflammation so we can actually treat the tissue or the joint that we're trying to work on. Some people come in and I call it a hot low back. Their low back is just so painful you can't even treat them. That's when we kind of can tailor to allopathic care. So if someone brings me in their MRI and they have 3 disc herniations in a row and they can't even lay face down on the table, that's when it's, hey, maybe you go to your PCP and see if you could get a steroid just to kind of ease the symptoms, a 5-day Medrol dose pack or a prednisone pack. And then it's more manageable for us to kind of work on you so you could reach your therapeutic max benefit. Other things that helps with microcirculation. So once we get all that inflammatory proteins out and we start to try and heal the pathology at hand, let's just we'll pick a body part. For example, let's just pick the elbow. So lateral epicondylitis, which is basically just your golfer's elbow, presents with pain right here. Some people, you don't even have to be a golfer. I'm working with a woman right now. She's having pain just picking up a gallon of milk because every time she picks it up, it puts strain on those extensor tendons and it hits that lateral epicondyle. So when we get the laser over that lateral epicondyle, what it's going to do is it's going to decrease the inflammatory proteins at the area, take away the pain, and then we basically laser it on a different wavelength, the extensors, those muscles on the backside of your forearm. And that's going to help to get the good blood flow to the area so we could just treat it as efficiently as we can. And it also helps with faster wound healing. So my short story on how I got sold on the laser was, when we were in school, we're learning about it, and I just thought it was a warm light. Someone's just waving a red light over. That's not doing anything. I thought it was totally placebo. But when I was in outpatient clinic at Logan, we had a quadriplegic. So he went to every kind of doctor under the sun, could not get any help. He had an ulcer on his heel. He had a diabetic ulcer. He was running the risk of actually getting not only just from the knee below, but his whole leg amputated because this would not heal. So last ditch effort, he ended up coming to our clinic at Logan. And we ended up lasering his diabetic ulcer twice a week for 12 weeks. And no joke, it completely healed the ulcer and he did not have to get his leg amputated, which was unbelievable. So that was basically the first time I saw the therapeutic benefit and how great the laser actually works. So there's only a couple contraindications to the laser. You can't laser over a spinal cord stimulator, a pacemaker, and if you're pregnant, just because you don't want to draw blood flow away from the fetus. But there's just ample opportunity for you to get laser therapy treatment and just improve your quality of life. Huge in bursitis, Baker's cyst, like the cyst behind your knee, if you're having posterior behind your knee pain, massive with that. Any kind of tendonitis, because tendonitis, the suffix being itis is just inflammation. So we are basically just going to decrease the inflammation. And how we do that very efficiently is we have our CBD. So our CBD has the transdermal technology. So when we put it on the skin, it's going to go through your skin, but also if we use the photon energy from the laser to kind of drive it into the tissue, it's just going to work on steroids. So you're really, really going to get a huge reduction in inflammation, not only with our CBD, but with the laser kind of driving it into the tissue.
Do you recommend laser treatments for people of all ages?
Absolutely. Yeah. So I try not to laser anybody under the age of 10. Now you can, but you just have to pick a different wavelength. And I apologize, I forgot one of the other contraindications is over a growth plate, because you don't want that growth plate to ossify quicker than it should, because then you could have a false leg length discrepancy too. So I've lasered kids, from basically like 8 to 10 on. There's no cap. You could be 100 years old. Lasered a 100-year-old guy last year. And just, again, we're just trying to decrease inflammation at the cellular level and work on the calcium ion channel. And it just helps with the microcirculation so you can heal more efficiently.
And you mentioned referral to a medical doctor for a steroid pack under certain circumstances.
Yes.
Do you offer guidance as to who I should see if I don't know a PCP or don't have a PCP?
Yeah. So me and Dr. Orbach, we definitely refer people out to good PCPs that we like. And that's not the best thing. Obviously a steroid long term terrible for you, but short term, if you go for an MRI and you do have like 3 significant disc herniations or disc bulge, and you can't even lay on the table to even get treated, you're going to have the greater therapeutic benefit if you actually do maybe go for a 5-day prednisone or a Z-Pack, just to decrease your inflammation so we could treat you more efficiently. So we have MDs on, that we could definitely refer you to. And a lot of people, they just, if they're in pain before they even come see me, if their back's so bad, they'll actually even just go to MedExpress, and then they see me a couple days later, and they get treated. So also accelerated post-op recovery. So work with a ton of people, not just necessarily athletes, but people just, right out of surgery. So working with a woman right now, she is 2.5 weeks post-op. She just had bicep tendon repair, rotator cuff, and had a couple osteophytes. So an osteophyte is basically just degenerative change. Your body lays down more bone, and they went in and cleaned that out. And she is coming in 2.5 weeks post-op. And what we're doing is, it's one of its main effects is for the wound healing. So we're actually lasering over her arthroscopic scars, just so she doesn't create any so there's no fibroblastic activity, because you hear about scar tissue and you can't move your 100% what you were normally before. So what happens is when you get surgery and they cut through skin, ligament, tendon, muscle, you kind of get like mild fascial adhesion. So instead of your mild fascia and your muscles kind of being organized more linear, they kind of get tangled up, and they're kind of just junked up, right? So that's when you have your trigger point. So when she comes in, we laser over her scars, and we're just bringing the good blood flow to the area so she could heal more efficiently. Yeah, so that's another benefit of that as well. So long story short, do you have to be in pain to see a chiropractor? Absolutely not. I work with a lot of athletes that they come in, either once a week if they're in season, bi-weekly, and even out of season, they come monthly, just to make sure, check everything. So, right. So even if you're not in pain, just to get stretched out, me and Dr. Orbach do a great job working on trigger point release. We do, modified just myofascial release techniques just to increase the length of the muscle. And that's working at the GTO in the muscle spindle. So just to kind of get stretched out, come in, get adjusted. Again, we talked about what it does for the brain and your prefrontal cortex. So it basically just helps to sync your brain to certain structures in your body, just so you feel 100%. So you feel in tune from the brain down with the rest of your body. And again, we do lab work. So we've been sending people for more lab work, and you're seeing that even if you are feeling good and you feel pretty good in your own skin, you might be deficient in a couple vitamins and minerals. And we are so blessed to have the nutrition store out there that, we go over your lab work in an appointment, and we say, okay, we're going to get you on this protocol, walk in the supplement store, get your supplements, take them as we recommend. And when you come back, it's a night and day difference. So that's pretty fun to work with. And then if you are in pain, you could come in and you could get the laser therapy. We do a ton of other stuff. We have we were talking earlier at 8:30 about the Normatec compression boots and what they do, used for stage 1 varicose veins. And I call it giving you a fresh set of legs. So the marathon coming up in early May, a lot of people coming in, they'll just go for 20 to 30 minutes, and they'll go sit, watch TV. And it works with pneumatic compression. So it's basically going to push all the lactic acid, and every time you move, your cells create waste. So it's going to push the cellular waste through your lymphatic system, so you get fresh legs. So you just feel a lot better.
You mentioned growth plates. You don't want to laser over that. Tell me, for those who don't know, what's a growth plate?
So a growth plate, one of the most common injuries in adolescent, teenage people is you hear of the Osgood slaughters, right? So growth plate at the end of the bone, you don't want to laser over that because you don't want that to ossify as quick. So you usually grow until about 16, 17 as a male. You can actually grow up till technically 20 or 21 as a male. I didn't have that happen. But if you laser over a growth plate, you increase the body's you increase the body's healing and its healing process. So if you laser over a kid's growth plate, sometimes you could actually shunt the growth of, let's just you pick your femur, so your leg bone, right? So if you laser over that growth plate, it could shunt the growth of the bone. So then, in a couple years when you're fully grown and you go to a chiropractor and they say your hip's out or your leg length's off, it could be a false positive, just because, it's truly not necessarily coming from your pelvis or your SI joint. It's that you had an ossification of a growth plate in your knee or your ankle quicker, and you get your false leg length discrepancy. Yeah. So that's why when people come in, not only am I checking, the leg length at the heel level, but I actually check the pelvic, I check your pelvis, and we'll check the SI joints as well, just to make sure you don't have the false leg length discrepancy. Yeah. So, and then again, when you come in, we have the Normatec compression boots that are just going to help give you a fresh set of legs. The laser therapy is working great. And it's just not for athletes. The big uses are like a tendonitis, epicondylitis, and you can see on this picture here, just what it does, just from the decrease in the inflammation and the microcirculation at the cellular level, hitting the cytochrome C receptor, just so you could heal up to like 100 times quicker than what you normally would. So it's really, really nice when you get people who come in and they're like, yeah, I was going and seeing a chiropractor, and, for my elbow injury, I went like 12 to 18 times, not really getting any relief. They come in here within 2 to 3 visits. They're like, holy mackerel, I could pick up that gallon of milk and not have pain in my elbow, or I could pick up my grandkid off the floor and I don't have the pain in my elbow. So it's used for a wide variety of people. Yeah. So if you have any questions, come in, get on the book and see me. Totally slammed this week, but next week I should have a couple openings. And come in, get checked, even if you're not in pain, just for the overall just health and wellness. Just getting adjusted, what it does neurologically to your brain and the prefrontal cortex, and what it does at the cellular level with healing certain tissues and decreasing inflammation of joints. Works really, really well with I call it a hot low back or a hot neck. So if you have a cervical disc bulge or a lumbar disc bulge, what it will do to decrease the inflammation, again, as long as as well with our nutritional supplements. So like the X-Flame, bromelain, and just some of these certain supplements you could get on, that is just basically coupled with the laser and the therapy that me and Dr. Orbach provide here. It's going to decrease all the inflammation, so you don't have the neck pain firing and running down your arm. So not this week as I'm slammed, but next week and the following weeks, get on the book, come in, get an evaluation. It's a full evaluation. So we check, myotones, we'll check your muscle strength, we'll check your gait and see how you walk to see if you're compensating. And we just kind of fine tune everything so you feel the best you can and you could become the best you are capable of becoming with the supplementation and with the physical medicine. So the chiropractic, the soft tissue manipulation, stretching, and all that other kind of stuff too. So
We got another question here.
let's hear it.
I've had a chiropractor in the past use a steel comb on my trigger points. Do you do that?
Okay, so the steel comb, that's kind of referred to as like Grasson, or the more broad term is IASTM. It stands for Instrument Assisted Soft Tissue Mobilization. Yes, definitely do that. So depending on what we're working on. So that's the cool thing about the laser too, is we have the Rolls Royce in there. It's a class 4 therapeutic laser. Very, very high quality laser. So the only byproduct is heat. So that's actually a good thing when we're working on soft tissue. So I'm assuming if you got the Grasson, like that, the glorified butter knife, I'm assuming it was kind of for a muscle complaint. So when we laser you, the laser could heat up your collagen up to around. Okay, when you get the laser on tissue, it could heat the collagen up to around 100 degrees. When your collagen gets heated up, it becomes a little bit more pliable or mendable, just like if you're going to try and bend cold rubber compared to hot rubber. So when we heat it up, it's going to decrease everything at the cellular level. Your inflammatory proteins bring good blood flow to the area. So when we have good, healthy blood flow to the area, and when the tissue's heated up, when we kind of go over it with the Grasson tool, it's going to help to break up myofascial adhesion. So when we were talking about the formation of scar tissue and trigger points, your fascia and your myofibril, like your your fibrils of your muscle organize like this. When we go over it with the Graston tool, it's going to help it organize in a more linear fashion. And me and Dr. Orbach definitely do that. When we kind of go over the soft tissue, it's just going to help to, we can work with our thumbs on certain trigger points, but when we go over it with the tool, that will help to just treat the trigger points and any kind of like myofascial adhesions a little bit more efficiently. So yeah, we do the Graston, the IASTM. We also do can't say we do ART, but we do trigger point release. So you heard of the pin and stretch. So if you have a tight muscle, what you could do is you could shorten the muscle, pin it, and then stretch it back out. So it's going to make the muscle a little bit more elastic and just allow it to just go through its natural full range of motion, as opposed to you have a couple hitches in your giddy up, so to speak. So you could actually just helps with the muscle. So yeah, call in, come in, get checked out, come in, get some lab work. We could kind of fine tune what's going on with the biochemistry in your body. Get the muscle work, and yeah, that's about it.
Hitches in your giddy up.
Yeah.
I like that. All right. We now have a Philism or a Rossism. We get isms all the time around here. Jamie's got his, I got mine, Dr. Rose got his, and of course, Mikey Gallagher's got the most. But we now have our first Dr. Philism.
Yeah.
Hitches in your giddy up.
Yeah.
Is the giddy up, is there multiple giddy ups or is there only one? Okay.
Yeah.
So anywhere you have a giddy up, you could have a hitch.
Yeah.
So come on in and see Dr. Ross. That was fantastic.
Thank
Good job,
you.
Doc.
And then-
So folks, make sure you come in, see him in person. This energy is contagious and he'll help you. I've seen, he works with a lot of athletes like Jamie said, but my God, you've had every body type, every age come through here, and they're all coming back, and that's the sign of success.
Absolutely.
So good job. Thanks, Doc.
Not a problem at all.
Right,
and then tune in. So Friday, Phil, it's Friday at 9 a.m. So also have a master's in sports rehabilitation, and I'm going to kind of dive into Friday at 9 a.m. on you don't have to be an athlete to benefit from the sports rehabilitation aspect. We were talking about your gait, so just walking and everything. So, an athletic move is going to pick your grandkid up at the floor, so you don't have to be an athlete. Just everything we do with the sports rehab aspect can greatly benefit your quality of life. So tune in at Friday, 9 a.m., and we could talk about that a little bit more.
All right. Excellent.
All right.
Thanks. Good job. And we'll see you again on Friday. And coming up next, the anchor, Dr. Gideon Orbach, 10 o'clock, folks. Stay tuned for that. We'll see you then.